welcome to Health Diplomacy Youth Speak, a youth-led podcast on health diplomacy hosted by the Health Diplomacy Alliance's Health Diplomacy Youth Network, or as we call it, HDYN. I, Dr. Abhishek Bhatia, chair of the network, will be your co-host today with Bill Balhon, working group liaison at the network, and we are happy to welcome you to our special inaugural podcast episode titled Global Health: Why Health Diplomacy Matters. What makes this episode special is that today, September 24, marks the 1 year anniversary of the network, a crucial milestone in our journey that started at the United Nations Summit of the Future last year in 2024. Committed to advancing youth participation and empowerment in health diplomacy, we bring to you today's episode where our special guests will explore how health and diplomacy intersect in our daily lives to impact health at all levels. We know that to many, health diplomacy could seem a distant concept, difficult to grasp and to get involved.
But let us assure you that it is accessible and is shaping health for all interactions happening all around us. In our communities, in our choices, in global policies, and in the voice of young people shaping an inclusive and equitable health system for all. So today, we will engage in a conversation youth leaders from diverse regions and disciplines about their experiences working in public and global health to understand how health diplomacy is influencing and supporting their professional ambitions and initiatives. So now we invite you all to listen and join us along the way to reflect on the questions and discussion we have for today. Let us know what you think in the comment section. So now I invite our guests for this episode to briefly introduce themselves for our audience. First up, maybe Sanya, if you would be able to introduce yourself, please.
Yeah. Hi, everyone. My name is Sanya, and I'm a young global health professional working towards improving the health and nutrition outcomes in India via research and evidence-based interventions. I am also a volunteer member of the Health Diplomacy Youth Network.
Thank you so much, Sanya. Up next, we have Hafiz Hamza. Hafiz, you have the floor.
Thank you so much, Bill. Hi, everyone. My name is Hafiz Hamza. I'm currently working as the AMR Youth Liaison Officer at Tusik Blue Foundation and a member for the Health Diplomacy Youth Network. More importantly, my passions lie in antimicrobial resistance, access to healthcare, global health, and meaningful youth engagement, and actively working towards achieving the SDGs for a peaceful, equitable, and healthier future for all. Thank you so much.
Thank you so much, Hafiz. And lastly, we have Federica Castellana. Federica, please.
Thank you. Thank you so much. I'm Federica, and I am the country delegate for the Italian Red Cross in Djibouti. I'm also the secretary of the Young Professional Working Group of the World Federation of Public Health Association and the member of the F Diplomacy Youth Network. And I'm a public health professional working in international development and community-based programs. And I'm passionate about community involvement and participatory approach and youth empowerment. Thank you.
Thank you so much, Federica and everyone. It just goes to show how diverse we are in this room right now. And if there's one thing missing, it's definitely not passion, as we're seeing everyone so passionate about public health and health diplomacy. So we thank you for the excellent work you're championing in your communities and for joining us today. We are excited to hear from you and all throughout the discussion.
Thank you so much, Bill, and for all the guests of the podcast to introduce themselves so beautifully. And now let us kick off the conversation today very softly by exploring what health diplomacy means to you. We understand the importance of definitions, and health diplomacy certainly has a couple of definitions in literature. But we also want to embrace the nuanced, different perspectives on what this concept and tool can mean for public health practitioners across different regions and aspects of work. Sanya, why don't you start us off by sharing your perspective?
Yeah, so health diplomacy, as you said, it has a lot of definitions, but I think the definition that mostly works is that it is the intersection of global health and international relations, wherein countries collaborate together to improve the health outcomes.
Yes, certainly. Thank you so much. And yes, collaboration certainly is key, and definitely it certainly lies at the intersection of global health and international relations. And it really brings together, partnerships and collaborations between different stakeholders. So thank you so much for setting the stage and the context for that conversation. And now I'll turn to Hafiz from your experience, and curious to know your take about health diplomacy. And what does it mean? And what does this term and what does this concept really mean to you?
Thank you so much, Dr. Abhishek. So to me, health diplomacy means using dialogue, negotiation, cooperation, and I would also add compromise across borders and sectors to advance really the global health agenda, because health is a shared global good, it's so health diplomacy recognizes that health is deeply interconnected with politics, with economics, with security, with development, and solutions that require collaboration between governments, between civil society organizations, between youth, between international organizations. So health diplomacy is not just about preventing and responding to pandemics or signing contracts, but actually dealing with global threats that are a cause for inequity, that are a cause to that are causing a problem to our food security, and that are causing, most importantly, harm to access and damage to that. So at its core, really, for me, I feel that it's important we are building trust and partnerships to protect lives and create healthier societies all around the world.
Excellent. And that's a really global perspective and a high level perspective on health diplomacy from your experience and given your passion on antimicrobial resistance. Certainly, it is true in recent times when we have the Global Action Plan and the Independent Panel on Evidence for Action coming up. Health diplomacy certainly is playing a big role there for bringing together different stakeholders, various different voices, and member states together to accelerate action on important platforms that can drive prevention as well as mitigation of antimicrobial resistance around the world. So thank you so much for bringing in that global perspective, Hafiz. And now I will turn to Federica to understand, from your experience, what does health diplomacy mean to you?
Yeah, thank you, Abhishek. And it's interesting for me actually to hear also from the others and to see the perspective, because I was reflecting, like as you said, there are a lot of definition, for me, when I think about diplomacy, it means relationship, and I think that it's something that I see every day in my daily work, and it's not just building relationship, but also like keeping the relationship and relationship between government, between different association, UN agency and local actors. So it's really being able to have that connection. Is like a bridge, it's like diplomacy is like that bridge that is able to then put we can say health in the middle, and then using health to connect and to reach agreement through what's Afe said, through negotiation and agreement, like to reach the compromise. I'm going to use some word that Afe said, but I really see it as this bridge that connect and relate different stakeholders to reach and to put health at the middle. So that is what is health diplomacy for me.
Perfect. And what we see coming in from these perspectives is that it is both about relationships but also about compromises. And we deeply understand that health is political in nature. We see recent global geopolitical shifts. We see a lot of budgetary shifts as well. And we recognize and embrace that there are a lot of these aspects that go into creation of health for all around the world. And but also to bring in my perspective, if you would allow me, that we should also bring communities at the center of health diplomacy as well, because we often talk about health diplomacy and somehow it could be the visual that has been created around the world that health diplomacy is global, is international in nature. It certainly is, but it also is a bridge, as rightly said by Federica, between the global actors and the local communities, so that whatever is agreed at the global level makes sense and is relevant for the community's health. And the community's health in turn is shaping the conversations at a global level as well. So that is a bilateral and two-way flow of health diplomacy is what I would like to bring in to the conversation myself as well. But thank you so much, Sanya, Federica, and Hafiz for kicking us off by sharing about what health diplomacy means to you. And it just reminds us that and as I was trying to say that it is not an abstract concept or just a definition in theory, but it is definitely relevant to a mother that is seeking vaccines for a child, a young person in a conflict affected situation advocating for health, or to a government including health within its foreign policy strategy to foster health, driving international partnerships across borders. So it is really relevant and applicable in all of these contexts. And to accelerate the conversation and bring it close to home, I would now ask Bill to proceed with the conversation. Yeah, thank you.
Thank you, Dr. Abhishek. It was really insightful hearing your responses to how you define health diplomacy. So now we wanted to uncover how you see the role of communities and young people. How do they play in health diplomacies within your countries? We recognize each country has their own unique set of circumstances. So maybe you can give us some insight as to how it is within your own area. So maybe changing the order, maybe Federica, you would want to go first.
Yes, no problem at all. And I think I can use an example of the country I'm currently based, and I've been working for 1 year already in Djibouti, because I think that sometimes when we think about the role of youth and community, specifically youth in the sense, we say, like youth have a new perspective, energy, innovative, but I don't think it's just that, um, Djibouti is one of the African countries, and the African continent is the continent who has the higher number of youth, and they are part of the society. It's not just because they have innovative, like they really have a role in our society. And what I experienced this year in my work, because I still work with them volunteer of the Djibouti Red Crescent in activities with the community. I really think that young people can be able to translate and to make more accessible some information to the community, and that is also diplomacy. We said it's like agreement, is trust, is relationship, and so I think that young people can have this really important role of kind of let's just say a buzzword knowledge translator, to the community, and as part of the community. And we also do not have to forget that we young people, we are going to be the future, and so I really think that is a way of bringing health diplomacy to the ground. As Abhishek was saying, sometimes we have this idea of it's so far, it's just happened, at the international level, UN agency. No, health diplomacy starts also from the ground, and so youth can really bring that concept to the ground.
Thank you, Federica. It was really nice hearing about the active role of youth within communities, and I definitely echo how there shouldn't be tokenistic youth representation within projects. And in terms of us being the future, I definitely agree. But I also want to add that we are the present. We're working with all of society right now to make sure that we are represented and we are present within decision-making tables. So next, maybe Hafiz, you would want to give us your insights.
Yeah, thank you so much, Bill. And just building up on what Federica beautifully left off. Communities and youth have a very important role in the context of health diplomacy. I think first and foremost is about ensuring that the policies that are agreed upon are context specific and targeted for them, because if at a global level we are making policies that are not applicable to a certain community or to many communities, or for example, go against the beliefs of the communities, then are we really saying that that is a sustainable policy that will be helpful or impactful? Of course not. So we have to make sure that we are involving communities to have those sustainable policies, in the long run. But more importantly as well, it's about respecting the diversity of communities, whether you are in a country, whether in a continent. We have to respect the autonomy and the diversity of the communities. We have to respect their cultural and social beliefs, and make sure that whatever we are committing to at a global level are also making sure that we are not going against their beliefs, their cultural values, and what they hold sacred. So these are some of the important aspects that are there. But more importantly as well is to make sure that they are being involved in the co-creation, in the co-designing, in the co-planning of these policies. A lot of times you will find enforcement of policies, the policies will just come into place, regulations will just come into place without really understanding why do we need to change this? Why are we enforcing it? Why do we need to change our practices? I think it's when we work together, using health diplomacy, involving youth, involving communities, helping them understand, knowledge is power. When someone is able to understand the reason, the rationale why this policy is being introduced and how it will benefit them in the long term, whether it's socially, whether it's health-wise, whether it's economically, they're able to adapt faster in that change. And that's why the element of planning with them, consulting with them, making sure that you are giving them an active space to be able to air their voices is very important. But more than that, also, beyond once we have agreed these commitments, I think communities and youth play a very critical role in advocacy and accountability. You might agree on something, but they're always, who says that the policies are going to work 100%? They might look good in theory, but when you actually come on ground, they're not really working. So that's where advocacy comes in, to raise awareness. Youth and communities plays this critical role in making sure decision makers, policy makers are aware about these challenges that they're facing and advocate for changes, but also to hold accountable, these commitments that we make. We are seeing many agreements being agreed upon globally, whether it's in the World Health Assembly, whether it's in the United Nations General Assembly, whether it's at a continental level, but are we really holding our leaders, our policymakers accountable? Then that's where community and youth come in, to make sure that we are translating these agreements, these particular commitments into action at a community level. So those are some of the insights that I would like to share. Thank you.
Thank you, Hafiz. These were really wonderful examples of how young people and communities are part of the conversation of co-creation, of policies, of research, and everything about what affects them. Coming from your insights, I feel as youth, there shouldn't be work about us if it isn't with us. It should always involve youth and also other diverse groups of people within the community. So thank you, Hafiz. And now we go to Sonia. Sonia, please.
Yeah, so Federica and Hafiz explained very well how communities and youth can help in enhancing health literacy, creating more outreach. And I think I would like to add a slightly more personal perspective. So as somebody who freshly graduated and entered the workforce and has like almost a year of experience, I feel like some of the things that we just find out, like right as we enter the workforce, are very different from what we had learned in our modules in our colleges. And I feel like that fresh perspective needs to reach into the global health rooms, into the rooms where those conversations are happening. So our voices can be sort of the bridging gap between the things that are happening at the grassroots level and the policies that are being made uh, to create those things.
Thank you so much, Sonia. And it's a really deep perspective that you shared, especially as a young graduate. I agree with you very, very deeply that we should always be involved when it comes to decision making and also when it comes to our community efforts. So listening to everyone's reflections, I'm reassured that health diplomacy is becoming increasingly intergenerational. So we see the perspectives of how youth are bridges and how we voice out our perspectives when it comes to decision making. So we see it in local communities and across the platforms that we have within WHO and UN, as Hafiz mentioned. And that offers youth an opportunity to connect with policy and decision makers within their countries. So yeah, Dr. Abhishek, if you may.
Yes, thank you. Thank you so much, Bill, and to everyone for, this enriching discussion so far and, to shine light on the role of youth, but also on health diplomacy, where it is applicable on so many fronts of, what is called as the policy cycle. When, you start off with understanding a problem, but then, you have collaborations among stakeholders to create a solution on that. You follow the trajectory of the solution, you have a mechanism and a roadmap in place, and then you have levers for monitoring and evaluation, for having changes within the policy, changes within the solution. Sometimes the problem itself changes, as we are seeing in global health right now, that the perspectives that we started off with are challenged to a certain extent, where we have to foundationally change the way we look at the world and then come up with fresh aspects that need to be incorporated in policies at both the global and local levels. And this is where, there is the role of community, there is the role of people with lived experiences in various different contexts and geographies all around the world. So thank you so much for this conversation so far. And now to, shift our lens from being personal and professional about it in a very micro economic level, so as to say, but taking a broader perspective on global health as a whole. And as we were discussing already, that global health systems today are undergoing massive rethinks of global governance amidst geopolitical challenges and budgetary reductions and shifts. And as well as we are all aware that every country today is facing consequences of climate change, dealing with increasing incidences of pandemics and health emergencies, but as well as intersectoral health challenges like antimicrobial resistance, as Hafiz has pointed out, but also on advancing digital health and health technologies within their individual health systems. So I think it is really time for us to start thinking about how health diplomacy can be leveraged to turn these challenges into opportunities for inclusive solutions within our individual countries. And let's take some time now to get really deep into our individual contexts that we work and the challenges that we are seeing for our own individual countries amidst these global conversations and global challenges. And how do you think health diplomacy can play a role or is already playing a role to be a leverage for sustainable, inclusive solutions? So I think we can start off with Hafiz, and if you please would like to share your perspective with our listeners.
Yeah, thank you so much, Dr. Abhishek, for those fantastic insights as well. And in my context, I think it's very important that we are focused on making sure that we have accurate and inclusive cooperation at a regional, but also more importantly at a global level, because these cross-border agreements that we commit to and we sign, whether it's on disease surveillance, whether it's on stewardship of antimicrobials, for example, they're very important. It could be on trade-related health policies, medicine regulation. They tackle, the transboundary health threats, which is prevalent with AMR, because AMR knows no borders. And if, for example, you are working hard in country A to make sure that you have the right policies in place, you have the right frameworks in place, but then, and you agree with other countries that this is the framework we're going to use, but then country B and country C are not really following up on this and making sure that these agreements are being implemented, then we are really not solving, the global threat that AMR possesses. So it's important that, number one, we have proper regional and global cooperation that is, accountable and as well as, realistic, because we have to make sure that when we enter these agreements, it's not favoring, for example, high income countries, or they're not interventions or actions that can only be achieved by high income countries. They're interventions that can be applied in low middle income countries and, as rightly pointed out, impacting the last person. That means when a patient is ill and they need to get access to an antibiotic, for example, then whatever is agreed at a global level, it trickles down all the way to this person there, but also making sure that it's done in a rational way and used when it's needed. So this is really important. And right now we have discussions going on in terms of the formation of the independent panel for evidence on action for AMR. This is a very important space for health diplomacy to come in, make sure that voices for this panel are and the various representation is right and meaningfully done. But also we have the global action plan that is going to be updated for the second time. And so making sure that we learn from what happened in the first national global action plan, implementations and accountability and so on and so forth, making sure that all of those perspectives and lessons that we learned are being put into the second global action plan, and making sure that countries that were, for example, not able to keep up with the pace on the first one, they are meaningfully included and supported rightly as well to be able to achieve the global goals. Because if we are not working hand in hand, then we are really not going to go far, and the threat is going to keep rising. So we need everybody on board. But apart from that, another area which is really important is where health diplomacy can drive solutions in the context of AMR, is making sure that we are able to secure resources and technology transfer. Diplomatic engagements with international partners, for example, and high-income countries can unlock financing solutions, but also innovations and knowledge sharing that is taking place, and what has worked in other countries can then be transferred to countries where this knowledge is lacking or not existing. So this knowledge transfer of, for example, health system strengthening, lab capacity building, stewardship practices, will be really helpful in terms of moving forward the agenda and mitigating the global threat that AMR possesses. And I said initially as well that health diplomacy is also very important, because you're trying to balance trade and health priorities. Because I want to give you a certain example. AMR employs a One Health approach, which recognizes the interconnectedness of the human health, animal health, and environment health. So when you are looking at the animal and the agriculture, we are having a high use of antibiotics or chemicals in the production of these food and agriculture within the context of LMICs, for example. And so when they go globally to the markets to trade their products, high-income countries, for example, might put a regulation that we are not going to take agriculture that has a high rate of antibiotic residue within it. And so then that leaves you in a limbo, because you have this product that you want to trade off, but then you have this regulation that prevents that or compromises that. So health diplomacy is very important in balancing that trade and health priority that exists between different countries, and these tensions can be sorted to ensure both food security and health protection are maintained and respected globally. But I think also, just reflecting on what we've discussed in the past, health diplomacy, lastly, is very critical in amplifying youth and community voices, especially of the marginalized people within our respective communities. When we really think about it holistically, when we embed the perspectives of these groups that are marginally not represented at high level tables, the groups that do not have any voice, do not have any sort of say or advocacy, amplifying these voices, health diplomacy can really help amplify these voices and shape policies that reflect realities on the ground as we align towards global commitment. So we can position ourselves really well in terms of making sure we are having a safe and healthier future for all in this regard. Thank you.
Thank you. Thank you so much, Hafiz, for elaborating on how health diplomacy is relevant for antimicrobial resistance and for youth participation. And it is really interesting to see how you mention about the role of health diplomacy when it comes to intersectoral coordination and balancing of interests, but also international cooperation when it comes to supporting individual member states coming to the negotiation table, bringing in their individual interests, but also understanding global interests and having empathy towards competing interests as well. So it is really important for health diplomacy to be able to balance all of this competing interests that are coming on the fore when it comes to AMR, but also for various different global health challenges. And thank you so much for bringing that up. And I'll bring Sanya to the conversation with the context of India right now. What is something that India is going through when it comes to healthcare challenges, and how do you see the role of health diplomacy, of India's role in the global health stage?
I was actually waiting for this question. So I feel that some of the recent developments that have happened in global health since Trump was elected again, I feel now it's the onus has fallen upon the global south to kind of take over the role in health diplomacy to create better international cooperation. And I think India already did it. One of the biggest examples of India being an actor in global health cooperation was when India and South Africa together helped waive off the WHO TRIPS agreement for the COVID vaccines. And I think that was one of the biggest wins. And it is something that we should continue to do. We should continue to, while also being self-sufficient, we should be working towards reducing health disparities within the global south. And it is something that, because I feel like there might be other countries which might follow USA and, you know, start start leaving the WHO or reduce their role in the global health cooperation. So I feel like India is one of those countries which can now take over, and it can also work within the global south to increase the cooperation and also integrate health into policy making.
Thank you. Thank you so much for bringing this very important perspective, which is on the conversation right now at the global level when we are rethinking global health governance, when we are thinking about the global health architecture, when we are thinking about global health financing, on how it has been historically and going forward, what would make sense for low and middle income countries to restructure these various historical arrangements, so as to say, and to come up with novel, innovative mechanisms at a very regional level also, as some of the organizations and some research articles have been coming about with the recommendations about the novel global health governance and architecture going ahead. It is really important to look inwards, but also to try to find capacities within the region itself so that the complementarities are really very well explored and international cooperation still persists to be the cornerstone of driving global health reform when it comes to financing, when it comes to access, when it comes to AMR, and when it comes to dealing with conflict as well. So thank you so much for bringing that perspective. And I would like to now ask Federica to share her perspective. Within your context in Djibouti, what is something that you're observing when it comes to a challenge to global health, and how do you think is the way forward with health diplomacy? What role could it play?
Thank you so much. And I want to say actually that is always, I know Avis, and it's always amazing to hear from him. And actually you can perceive the passion that he has on AMR. He could just talk about AMR all his life. Like I had dinner with him, like just talking about AMR. Like this is something that happened, I have to say. But it's also was a very learning experience to actually heard from Sanya and the India example. I really think that this is also what we need, right? Like to talk and to share also this experience. I don't want to focus only on the context I'm based right now, because I am the only person in this call from a high income country, but like not global north, we can say, European, but I'm not based in Europe. I did not work in Europe. I work mainly in East and Horn of Africa. So it's really interesting, I think, at least for me, to see how the global health governance is actually changing, and then the role that health diplomacy can have. I just want to do an example. For example, the president of the European Commission, I think it was last week, when usually the European Commission has this speech where it actually explained what are the priorities for the year, and it's very interesting to say that global health was actually mentioned by the president, and it's actually something that Europe right now is like putting even more and more attention. But being then based in East Africa, and right now I'm working in Djibouti, but I'm also working in Kenya, I'm also working in the Indian Ocean Island, I'm just traveling a lot, and so I see all of these regional approach that it's actually increasing. And what Sonia said made me also reflect on the global South cooperation that is increasing, and how this is actually gonna affect then positively, from my perspective, the global health governance and all the changes that we are having. And so I think that the role of diplomacy in all the challenges that we have, and I think one of the main in the global public health area is financial, and I think that we can say it very loud. I think it's really this possibility of changing the system, changing the perspective, and really allow the different countries to really come together and say, okay, how do we want right now to move forward, right? What do we want to do? Now we know that the system is like crashing a little bit, cracking, we can say everything, but then is the time to see how we can better organize and having actually more let's say ownership also to the global South. I think that this year there was the BRIC meeting in Brazil with the 20 different countries, and I think, if I'm not mistaken, also India was there. If I'm not mistaken, I may be mistaken, but like I think that is one of the example of how have diplomacy, and then specifically have diplomacy, it actually going beyond and is growing and is allowing the country to give a different position, you know, and reach that agreement that we said at the beginning, the bridge. And I'm gonna say other buzzwords that are very nice, you know. Last year I've been hearing so much from global to local, and so there was this word glocal. I don't know if you remember, but it was everywhere in all the research, everything. And I think we are starting, you know, like I think that the research is starting, the global area like started to talk about that, but right now we are actually making step, you know, to then from global to local through this system transformation. I don't know if it makes sense what I said, but when I heard Hafiz and Sanya talk, like this really made me reflect on all of this component, and I actually also write down, because I really think that it's super interesting to have this kind of conversation and to reflect on what is happening around us while we are just in different countries and talking about, you know, cross country and cross sectoral challenges and what can we do. So it's I don't know, it's a lot, but I hope it makes sense.
Yes, absolutely. I think it makes perfect sense of, you know, what is happening right now. And I think it's a good opportunity to rethink a lot of assumptions that we've always had about global health, because once we get comfortable with business as usual and with the status quo, we seldom take the time to sit down and think critically about, you know, where these systems that we today call home, or today we call status quo or business as usual, or the practice in which all of us have entered our lives as healthcare professionals and then adopted and absorbed ourselves into the system, learnt about the system, and then tried to navigate the system and understand the system and be a part of it. But it is very rarely that we receive the opportunity to take a third person's perspective and critically reflect about the system as it is and try to reimagine a lot of things. And I think, you know, what the three of you have just shared highlights that health diplomacy is relevant to different health problems across regions and to various aspects of the health challenges in various situations around the world. I think this summons our imagination to see solutions in the face of challenges by working together, sharing our experiences, and staying engaged in the process of ideating and executing innovative solutions via partnership. And, you know, and to look ahead again, I'll ask Bill to, you know, to share his perspective to some extent, but also, you know, to carry on the conversation.
Thank you so much, Dr. Absek. I'm just absorbing everything that all of our guests are saying. It's been really insightful, even as someone from a different region within the globe. So now actually we looked at our perspectives, the guest perspective, as to what health diplomacy means to their communities, to their youth leaders, how their communities and young people are getting involved in health diplomacy, and what role it plays in the context of current global health challenges. But now I'm curious of us dreaming forward. So we actually want to ask everyone here, what is your hope for the future of global health, and how do you think health diplomacy can help make it real? So Sanya, maybe you can go first.
Okay. So I think my hope is that the global south takes on a bigger role in health diplomacy, and that we are able to reduce the health disparities, create a more equitable platform for everyone, and improve the health outcomes in all the countries with the help of, diplomatic and international cooperation.
Thank you, Sonia. I agree. Health equity is really a very big goal for us. And the role of youth cannot be underestimated within this discussion points. Talking about being in the decision-making table and also working with local communities and our policymakers and governments to make sure that it is contextualized and adapting to the health needs of young people and other marginalized populations. Thank you, Sonia. So up next, maybe Fede, you can give us your insights to your hope for the future of global health.
Yeah, so I'm a very idealistic person and positive person. So I think that what I would like, what I work every day. I think that this is also why I do the work that I do. Is I really think that health is a human right, and I really fight for human right. And in my work, I see a lot of rights that are not respected, and health is one of it. And I think that we can see also it uh, around the world. But I don't know, idealistically, maybe too much. I don't know. I hope and the future for global public health is that health, and not only healthcare is considered and will be considered a human right and will be central in all the policy, at the government and at the global level. And so I think that or at least my hope is that F diplomacy can actually be used as a tool, because we know, I think that Abhishek said at the beginning, health is political, and we repeat and we said and we see its use also. It's also one of the things that the politician also use to get more vote, etc. Like what is one of the things. So I really hope that diplomacy can be used as a tool to advance the concept of health as a human right, and so that health need to be central in all the policies. So yeah, and maybe not. Why not? I'm positive. It will happen. It will happen.
Thank you, Fede. We support your passion and your hope of having health as a right. And I do agree. We see so many people working for that same goal. And I do agree. I want to be realistic, and also I want to be optimistic in terms of health being a right. And I want to say in a few years, or maybe not a few years, but in the middle future, we can see this happening. And lastly, we have Hafiz. Hafiz, please tell us more about your hopes and dreams for global health and how you see health diplomacy being used for this.
Thank you so much. So my hope for the future of global health is a world where we have a reduced threat of antimicrobial resistance, a hope where access to quality healthcare and medicine is not determined by your geography or your income level, a hope where youth are not just passive recipients of health policies, but actually active shapers of a healthier, fairer, and more sustainable world, but also a hope whereby the voices of those who are marginalized, the voices of those who are in war-torn countries, the voices of those who are often neglected are also listened to and heard and respected and implemented meaningfully, to be honest. And I think how health diplomacy can support this vision is really by making sure we have platforms for inclusive dialogue where people, whether youth, whether marginalized communities, whether people from war-torn countries can participate as equal stakeholders in the decision-making that will influence their futures, but also strengthening global solidarity in times of crisis like the pandemics. And then we see health inequities coming up. So we need that strengthened global solidarity to stand together, but also more importantly, to build that trust, because when you trust one another is when we can move forward together, honestly. And lastly, I would also say building bridges between science and action. I think science, policy, and action, because we are seeing a lot of research being done, which is then supposed to translate into impactful policies or sustainable policies. But then again, these policies need to be enforced at a local level to be able to be implemented, and making sure that the chain, all the way from an agreement at the top in the global level, is then trickling down to a country, to a national, to a city, all the way to the homes of the people that are living in them. So that is my hope for a hopefully a healthier, fairer, and more equitable world. Thank you.
Thank you, Hafiz. And first of all, I'm seeing what Fede mentioned about you being so passionate about AMR. The first word out of your speech was antimicrobial resistance. So I definitely agree with you. It is also one of my personal passions. But looking into what you said, I definitely agree when it comes to having research translation and utilization as part of the conversation. When we're talking about our hope for global health in the future, we definitely play a role in presenting, representing, and also securing the safety of youth and marginalized populations when it comes to these discussions. And just to reflect as well from our own perspectives, in the Philippines, we're seeing one of the most significant factors, political will, and good governance, or if I can say, lack of good governance, exposing novel threats to progress in public health. So this makes me reflect, actually, as what Fede mentioned, we're here to reflect on all of the conversations we're having, adding on to what you three mentioned, how health diplomacy activities made by young people is being and can be used to support the various stakeholders in co-creating solutions to address systemic, local, national, regional, and global issues. So now I thank everyone for your very active participation. I see that our discussion truly highlighted the role young people have in shaping the future of global health through health diplomacy. So, Dr. Abhishek, I give the floor to you.
Thank you so much, Bill, and for our guest today to take us through so many different aspects of global health that are ongoing. And I'm really thrilled by this conversation and feel so inspired to continue doing the good work of global health with a renewed spirit. This discussion, for one, has been a reminder for our vision of fostering together a healthier world, and to communicate that the work of health diplomacy is ongoing, intergenerational, inclusive process that has immense scope for all of our personal experiences, perspectives, and hopes. And we couldn't have had a better celebration for the 1 year anniversary. So I'm truly grateful for the participation of all our guests today who took their valuable time to join us. And I know that we would definitely like the conversation to be ongoing, but for the sake of time, I think we'll have to thank our guests right now for this episode, but definitely we promise to bring more of such podcasts and episodes for all of our audience and viewers, where such conversations are becoming the norm, and we aim to create a platform where such conversations nurture and flourish. So I thank all the guests for their time today. So thank you, everyone, and I'll hand over Bill to share more about the upcoming work and how people can be engaged with us.
Thank you, Dr. Abhishek. I want to echo your appreciations for everyone here today. Thank you so much for taking time out of your busy schedules. So if everyone wants, maybe you can give a quick appreciation all together. We say thank you to our virtual audience for today. So if you can unmute, and then I'll count 3, 2, 1. Okay, 3, 2, 1. Thank
Thank
you,
you.
Thank
everyone.
you. Thank you.
Thank you so
Okay.
much, Rick.
Thank you. And now, we just want to give a few closing remarks from the Health Diplomacy Youth Network. We want that as we're ending this discussion today, for our listeners to also reflect, and if you want, you can tell us in the comment section, what does health diplomacy mean to you? And what do you think your role is in terms of the future of global health? So maybe our guests can also share this with their networks, ask them to join in the conversation and share their perspectives with us. And with that, us, your hosts, Bill and Abhishek, would take our leave. This has been the Health Diplomacy Youth Speak. We hope to see you in our future podcasts and events. And to stay updated about the Health Diplomacy Alliance and the Health Diplomacy Youth Network, we ask you to visit our website, hdalliance.org, and follow us through our social media pages on LinkedIn, X, YouTube, Instagram, Blue Sky, Spotify, and Facebook. And until next time, stay healthy, stay hopeful, and stay curious.